Fascinating new study on genes today. Researchers say your DNA may help determine your threshold for pain. Dr. Mark Siegel is a professor of medicine at NYU's Langone Medical Center and a Fox News medical aid teamer. Joking around earlier, we thought it was only gender, right? That women are tougher and can take pain better than men. But apparently, according to this study, it could have something to do with your genes. Do you buy that?
I completely buy that, both things. I think women are better at, but women take pain better than men.
That's a good answer, Dr. Siegel. Right.
Men are inflicting pain on women all the time. They're better at it. But I also think there's genetic variations. And this study comes out of California, and it's being presented right now to the American Academy of Neurology in Philadelphia. 2,700 people were studied. There's limitations in the design of the study, I think, because they only studied people that already had chronic pain. And I treat a lot of people with chronic pain, and I don't think their answers are always that reliable, because they're used to the medications they're getting. They're on opiates, you know, and they may not exactly tell pain the way everyone else tells it.
And so the way the study was put together is essentially they were asked a question about how much pain they were feeling, and then the researchers were looking at their genes and trying to see if different people with certain genes, right, felt pain in a certain way, and they thought that they found some sort of pattern on that. If that did come out to be the case, and obviously further research needs to be done, would that change the way, for example, you prescribe pain medication? How would it impact how we treat people?
It would impact greatly, and I think you described that absolutely beautifully. They found that the DRD1 gene, was higher, 30% higher, if pain didn't bother you. The DRD2 gene was 25% higher if everything made you feel pain. So there's differences from one person to the next, and genes probably help us determine it based on now that we know the human genome. So in the future, if I looked down my medical crystal ball 10 years into the future, I think we're going to have a situation where I'm going to say, hey, Jenna, you're feeling a little more pain because you have a little bit more of that DRD2 gene, and maybe I can offer you a splicer to change your genes a little bit so you don't feel the pain as much. That's where we're heading. I don't know if insurance is going to cover it.
Well, that's a big question. Yeah. So it'd be less potentially about the treatment that we would give on medication, and maybe we would treat people more when it comes to their genetic code?
We might be able to. They're starting to do that in animal research right now. There's a study out of MIT using something called CRISPR technology, where they took an animal with a liver problem based on a single genetic abnormality, and they corrected it. Now, when you use that technology on a cell, it causes a lot of disturbance, so it's not ready for prime time in humans yet. But I could see that in the future. Hey, let's snip out that DRD2 gene.
It's almost as if you could copy it. Just like we edit some of our writing, it would be like doing that for your genetic code. How would that work for a normal person, a normal situation? How would that be applied where a doctor would say, you know what, I'm going to look at your genetic code, and if something doesn't look like, I'm going to go ahead and edit out that particular code?
And as you pointed out to me before we came on, it starts right with a fetus. We may be able to do that early in life and say, you know, your chances of getting diabetes here are 48%. What do you want to do about that? Well, maybe you'll alter your lifestyle. Maybe you live knowing what your risks are. It would help me medically to treat you. And maybe that snipper will come along later on if I think the disease is going to happen, especially if it's a deadly disease.
I know you've written on this topic before many times, so I know we can talk about it on the air, about when you think perhaps as a doctor you're crossing the Rubicon, if you will, if you're playing God too much. Does that come up for you at all when you look at some of these genetic studies about what we're able to do now potentially and how invasive we can get with our genetic makeup?
Really important question, and I have written about it, and I think I always want to stay on the side of the line where we're talking about disease here. I don't want to be choosing blue eyes over green eyes. I don't want everyone to look as beautiful as you, Jenna.
I mean, don't know. I got a lot of makeup on, Doc.
People should be who they are, and I don't want us choosing gender for sure. We have to stick to diseases.
So that's interesting. So this same sort of genetic editing in different cases could be used potentially, you want to say good, you know, for evil instead of good, but for other more cosmetic causes rather than for causes that have to do with illness.
Exactly. That's where it starts to get very I don't want designer babies. I don't want designer people. But I do want to say, hey, here comes Down syndrome. Maybe we can prevent it from occurring before it ever does.
Fascinating. What about designer shoes? Are you okay with designer shoes?
Those are fine.
Okay, I was just I'd like to get a medical opinion on it. It's fascinating, though, to see all the research that's being done on genes and where we're going on that.